suffering from lower back pain should always see their GP before starting out on a training program. And you should definitely make sure that they get medical clearance, because the pain could be from a number of conditions like kyphosis, lordosis, sciatica, things actually affecting the spine and causing postural deviations. So once you know exactly what the cause is, you'll be able to assist in strengthening the spine as well. That way you're helping the client manage their pain. And what you'll need to do is you'll need to strengthen the core. The core actually supports the spine, so doing a lot of abdominal work will actually assist the person in being able to stand up straighter, feel less pain, and basically get more quality of life and hopefully eliminate a lot of the pain, which would be excellent. Whenever training a client with a back problem, a lower back problem, it's always a great idea to make sure that you're mobilising the back whenever they're exercising. So for example, when doing squats, having the client use a Swiss ball to actually work through the movement. Standing on the wall, having the Swiss ball supporting their back, they'll be able to get the full range of motion, the back will be mobilised, and they'll be at a lower risk of injuring themselves basically. Just make sure you do the proper spotting with that one as well. Whenever they're doing moves like the plank and push-ups, make sure that their lower back isn't sagging on the ground, make sure that they're keeping a nice flat back, neutral spine, that way they're not adding to the pain with that one as well. I would avoid doing exercises like crunches and sit-ups, because that can put a lot more pressure on the lower back. You should really avoid sort of most of the dynamic abdominal exercises where clients are twisting too much and they're doing too much trunk flexion and extension, as well as loading it too much until you've strengthened their core a bit more. So the quadruped exercise is another really good one, where the client is on all fours and they're raising their opposite leg and arm, putting it down, raising their opposite leg and arm again, so they're engaging the core there. And you can also, as I said, Swiss ball crunches, because the back's stabilised, the body can move, so you're actually supporting the lower back when you're doing that. Swiss balls are also great for mobilising the back, because the client can stretch out and they get a really nice stretch, alleviate some pain as well. Another method of training the core and without too much pressure on the lower back is actually using suspension training. So you can get your full body workout using the suspension training, because your body is basically in a plank position for most moves, while you're actually using the suspension equipment. So you'll be doing your push-ups with the suspension ropes. So you'll be in a plank position, and your body will just find itself naturally engaging the core, thereby strengthening it as well, and without putting too much pressure on the lower back. And I think that's about everything that I can think of today. So yeah, definitely make sure that when you're training clients with lower back, you're always mobilising that lower back, doing appropriate stretches, and strengthening the core. Another thing that may also affect pain in the lower back area is tight hamstrings. So also make sure that the clients are stretching their hamstrings appropriately, so that they're not getting too tight.